How to get rid of chronic back pain without surgery or pills. So, chronic back pain affects 1 in 3 people globally. It's the leading cause of disability, missed work days, and expensive doctor visits. Yes, most treatments never address the root cause. Dr. Ray Peralta, Doctor of Physical Therapy, and Run Coach. I've been in the field for almost 10 years helping people recover from injuries, rehab, and get out of pain. Not with surgery or pills, but by changing how they live. In this video, I'm going to break down lifestyle medicine approach to overcoming chronic back pain and why it's especially powerful for runners. The reality of chronic low back pain. Low back pain affects 18 to 28% of the population and up to 60% of people with a prior history. That means if you had back pain in the past. It worsens with age and is the number one musculoskeletal condition. That means the number one orthopedic cause of pain worldwide. In the U.S. alone, $420 billion are spent each year on musculoskeletal or orthopedic problems, most of it on treating the symptoms, not the cause, right? Injections, surgeries, pain pills. But among runners, low back is less common, but it still affects up to 20% of them at some point. But here's the problem. We live in a sick care system, not a healthcare system. Insurance covers drugs and surgery, but not the lifestyle changes that actually fix the issue. So the underlying cause is often tied to lifestyle. And that's something that people don't even realize, that their lifestyle can contribute to pain, right? Diabetes, heart disease, so many things that lifestyle can contribute to, so many causes of disease. So nutrition and inflammation. Most people don't realize that their diet is fueling their pain. The standard American diet is full of processed foods, sugars, and seed oils that keep the body in a state of chronic inflammation. Inflammation can increase pain sensitivity. Excessive processed foods, trans fats, omega-6s from things like soybean, corn, canola oil, right, can be pro-inflammatory, which means it increases inflammation in the body. Processed meats, too excessive sugar, alcohol, refined carbs can also be major triggers of inflammation. Instead, follow an anti-inflammatory diet, things like the Mediterranean diet or a whole food plant-based diet like vegetarian or vegan. You could add omega-3s, chia, flaxseed, walnuts, or algae oil, right, or fish oil to get more omega-3s in the body, which will help decrease inflammation. And then you may even consider an elimination diet if you're sensitive to dairy, gluten, wheat, or even nightshade like tomatoes, potatoes, peppers, which may trigger inflammation in the body for some people. But remember, food alone isn't everything. Sure, it's very important, and you have to still combine it with movement, sleep, and mindset. Because if you just do the nutrition but ignore everything else about your body, right? If because you can still overeat healthy foods technically, and then be overweight, and that's no good. Because when you're overweight, you're still in a state of constant inflammation. The next thing for lifestyle medicine is exercise. Exercise is medicine. Movement is medicine. Did you know that a 6-mile run can release the same amount of endorphins as 10 milligrams of morphine? That's the power of movement. And you don't necessarily have to run to feel it, right? Because maybe you're in pain, you can't run at the moment. You can still do zone 2 cardio, like walking, that's low impact, or you can do run walk or jog walk or bike or swim. So there's other low impact exercises you could cross train to still get that zone 2 benefit and get you the benefit of decreased pain. So typically you have to do more than 10 minutes at zone 2 cardio to get relief, but you'll get better results if you're approaching closer to the hour mark, like 40 to 60 minutes or so will give you the better effects because it'll be closer to that 6-mile run mark. You want to target about 5 hours a week of moderate aerobic activity, or again, you could cross train. Further, if you're overweight or obese, even a 5 to 10% weight loss can ease pressure on your spine and decrease your pain. Next, you also want to do strength training. Strength training also reduces pain, improves your resilience. Now, strength training might be too challenging for you, you could just do something as like isometrics, where you squeeze the muscles together, grab a gripper, do wall sit isometric. And the cool fact about isometric is that it can actually reduce leg pain. For example, if you got leg pain, but you do like an isometric hand exercise, just gripping something in your hand can actually help decrease leg pain. That's called remote hypoalgesia. Right, and it's the beauty of exercise. It has like systemic effects on the body. They're beneficial. So even if you can't tolerate like heavy weights, again, you can start with isometrics, body weight, and then progress as you get better and your body can tolerate more. Next, sleep. So many people sleep on sleep. It's often, forgetting, or many people miss, they think they're getting 7 hours of sleep. They're only getting 6 hours of sleep. See, poor sleep equals poor healing and more pain. But 1 in 3 adults aren't getting enough sleep. And most overestimate how much they actually sleep. They've actually done studies where they put like a monitor, like a little watch, wearable monitor on people, and they think, oh, I'm sleeping 7 hours a night. But then the monitor actually shows they're only sleeping 6 hours a night. See, when you sleep less than 7 hours a night, it'll go, you're sleep deprived, your nervous system's going to be more sensitive, and that's going to cause you to that pain cycle to persist, right? That chronic pain, poor sleep leads to that pain injury cycle where the injury or the pain is never fully healing, never going away. So tips: wind down 1 hour before bed, no screen, dim the lights, read, breathe, gentle stretches, and aim for 7 to 9 hours of actual sleep, not just time in bed, with your phone doom scrolling. Next, stress in your brain. Chronic pain isn't just physical, it's emotional and mental. Stress increases cortisol and makes your body more sensitive to pain, right? So sometimes people don't even realize that their work stress or life stress, relationship stress, etc. can cause tension in their body that are holding up, and that could cause the muscles to tighten up and decrease blood flow and cause more pain sensitivity. So what can you do? Big fan of meditation. Lay there, sit there in a comfortable, relaxed place. Start with just 5 minutes a day, and then go up to 10 minutes, 15 minutes of meditation. I personally try to do meditation at least twice a day. It's so powerful. Mindfulness exercises, right? Being mindful of your breathing, being mindful of how you eat. Definitely to take up gentle yoga, Tai Chi. So motion is lotion, right? And when you're doing gentle movements, you're retraining your body, retraining your nervous system, and that's going to help decrease the pain sensitivity that you're feeling, right? And remember some positive mantras, right? Tell people, hey, remember that, hurt doesn't always equal harm. I'm sore, but I'm safe. And that motion is lotion, right? Because sometimes people are so afraid of movement that they don't even want to move. So you kind of have to retrain and kind of walk yourself through small steps. And eventually you're able to go from walking to run, walk, and then running, if that's your goal. And then next, if you're a runner, or you used to be a runner, but then pain sidelined you, when can you get back to running? So I tell people a rule of thumb: can you comfortably walk a 5K, right? It's usually, can you walk for about 30 minutes? Some people want more of a buffer room. Can you walk a 10K? So maybe it'll take you an hour or longer. And then you could begin to follow a gentle return to run program or jogging program. Start with 10 seconds of jogging, 50 seconds of walking for 10 minutes. See how that goes. Take a day off or 2 days off in between. And then gradually increase the portion of the run interval or the jog. So you're doing maybe 30 seconds of run, jog, and then 30 seconds of walk. And then eventually you're doing 5 minutes of run and then just 1 minute of walk. And if that's too hard though, or maybe you're not ready to go to running right away yet or run, walk, you can start with biking, swimming, or gentle strength work. The goal isn't to push yourself through hard to flare you up, but it's to gradually build you back up. So back pain doesn't have to be a life sentence. I've seen people in their 60s plus reclaim their mobility, ditch the pain pills, and get back to doing what they love. Some even get back to running. The key is consistency with nutrition, movement, sleep, and stress management. And in 3 to 6 months, you may just look back and realize, wow, that pain is no longer running your life. Now you're running your life the way you want to. So if this helped you, hit the like button, subscribe for more pain-free running tips, and watch my next video. And if you're struggling with pain and you're trying to get back to running, check out my free training that I'm going to drop in the link below in the description.